If you're watching this video, you're likely a candidate for bariatric surgery. The purpose of this video is to describe bariatric surgeries and their related complications, and answer the most common questions on bariatric surgery. If you have other questions or concerns after viewing this video, please discuss them with your nurse or physician. The complications of obesity. Your presence here today means that you've decided to seek other ways to help you lose weight and try to solve your problem with obesity and the health issues resulting from it. Obesity is defined as excess body fat that may impair health. It is measured in terms of body mass index, or BMI. Body mass index is calculated from a person's height and weight and is normally between 20 and 25. The BMI also helps determine the type of obesity. Obesity is defined as having a BMI equal to or greater than 30. Severe obesity is defined as having a BMI equal to or greater than 40. People suffering from severe obesity, a BMI equal to or greater than 40, or whose weight is about 45 kilograms or 100 pounds over their healthy weight, may be candidates for obesity surgery, also referred to as bariatric surgery. Several health issues or complications are the result of obesity, including diabetes, high blood pressure, heart disease, sleep apnea, gastric reflux, infertility, various joint disorders, and hepatic steatosis, or fatty liver, that can lead to cirrhosis. Certain cancers are also associated with obesity. Patients who suffer from obesity may also experience various mobility-related problems and difficulties accessing certain areas. Bariatric surgery. The goal of bariatric surgery is to help patients with severe obesity lose their excess weight. This weight loss helps, among other things, reduce or avoid complications caused by obesity, and improve patients' quality of life. You'll be able to establish how you could potentially benefit from bariatric surgery by discussing it with your physician. The different bariatric surgeries. 3 types of bariatric surgeries are frequently used to treat obesity: longitudinal or parietal gastrectomy, gastric bypass, and biliopancreatic derivation. In certain cases, the surgeon may suggest other types of procedures. Some complications are common to all bariatric surgeries, while others are specific to one or the other of these surgeries. Common complications include conversion to open surgery, wound infections, bleeding requiring transfusions, thrombophlebitis, or a hospital-acquired infection. These complications are usually diagnosed within the first month after surgery. The risk of mortality is about 1% and can occur following a heart attack, pneumonia, or pulmonary embolism, or a leakage of gastric fluid with peritonitis. Some patients will not experience significant weight loss or will gain weight following their procedure. This normally happens when patients revert to poor lifestyle habits following surgery. Normal digestion. The digestive system is comprised of several organs that transform and absorb food. Food travels from the mouth towards the large intestines. Normal digestion follows this route. Food is first chewed in the mouth and then passes through the esophagus to reach the stomach. The stomach acts like a reservoir where enzymes and gastric contractions come together to transform food into semi-liquid matter. The transformed food makes its way to the small intestine. The main function of the small intestine or small bowel is to absorb food. This absorption mainly occurs at the beginning of the small intestine in the duodenum. Lastly, the large intestine or colon transforms the liquid residue into solid waste, or feces. Bariatric surgeries have an impact on normal digestion by reducing the size of the stomach or shortening the length of the small intestine, which reduces the absorption of food. Satiation, or the feeling of fullness or satisfaction, is transmitted by nerve impulses activated when the stomach is stretched from food. This message takes 20 minutes to reach the brain, regardless of the size of the stomach, with or without surgery. It will be very important to eat slowly to reach satiation without overeating following your surgery. The mechanisms involved in weight loss following bariatric surgery. The mechanisms involved in weight loss following bariatric surgery are restriction and malabsorption. Restrictive surgery limits food intake by reducing the size of the stomach. Malabsorptive surgery limits the absorption of food by shortening the path food can take through the small intestine. Treating obesity involves several components. Lifestyle changes in terms of dietary changes and adapted physical exercise form the basis of treatment. These changes must also be maintained by patients who have had surgery. In some cases, patients may also be prescribed medication to stimulate weight loss. The different procedures used to treat obesity result in different amounts of weight loss that are proportional to their level of risk. The types of bariatric surgeries.
Longitudinal or parietal gastrectomy, also called sleeve, is an intervention that involves mainly one mechanism that promotes weight loss, namely restriction. The stomach is divided into a small banana-shaped stomach. This new stomach contains about 120 to 200 milliliters. The other part of the stomach is removed. The small intestine is kept intact, so there is no malabsorption with this surgery. After surgery, you will lose an average of 40 to 60% of your excess weight, with a better result if your body mass index is less than 50. If, for example, you have an excess weight of 100 pounds, you will lose about 50 pounds. In terms of post-operative risks, they are considered low, with a mortality rate of about 0.5%. The risks specific to this surgery are leaks along the staple line that can be long to cure and require reoperations, or gastroscopy treatments.
Gastric bypass. Gastric bypass involves two weight loss mechanisms, restriction and malabsorption. The main weight loss mechanism in this type of surgery is restrictive. The stomach is divided into two parts to create a small reservoir that will become the new stomach, which will hold 30 cc's or 1 ounce. The other part of the stomach remains in place, but it no longer has any contact with food. A part of the small intestine is then connected to the new stomach. Since food now takes a shortcut from the new stomach directly to the small intestine via the pylorus, a part of the small intestine is not used to absorb food. This is the malabsorptive aspect of this surgery. This procedure results in mid-range weight loss. Following the intervention, you will lose on average from 50% to 70% of your excess weight. If you are overweight by 100 pounds, for example, you'll lose about 60 pounds. The risks are considered to be moderate compared to the two other surgeries, with a risk of mortality of about 1%. The risks specific to this procedure are leakage at the two connection points. Not taking supplements on a regular basis can also lead to inadequate absorption, resulting in iron deficiency or anemia, calcium deficiency, or deficiency of certain vitamins, such as vitamins B12 and D. Due to the fact that part of the stomach is no longer in contact with the esophagus and the mouth, Diagnosing and treating certain stomach diseases, such as stomach ulcers, may prove difficult. This is why patients who have undergone this type of procedure will not be able to take anti-inflammatories for the rest of their lives. Biliopancreatic derivation. Biliopancreatic derivation involves two weight loss mechanisms: restriction and malabsorption. The stomach is sectioned to create a stomach in the shape of a banana. This new stomach holds about 220 cc's, or 8 ounces, or a reduction of about 50% of your stomach. The other part of the stomach is removed. This is the restrictive aspect of the surgery. New connections are made with the small intestine, and only half of the small intestine is used for passing food, resulting in a reduction in food absorption. This is the malabsorptive aspect and the primary weight loss mechanism in this procedure. This procedure results in maximum weight loss. Following this intervention, you will lose on average from 60% to 80% of your excess weight. If you are overweight by 100 pounds, for example, you will lose about 70 pounds. This procedure carries the highest risks compared to the others, with a risk of mortality of about 1.5%. The risks specific to this procedure are leakage at the two connection points and the consequences of significant malabsorption. This generally involves an iron deficiency or anemia, a calcium deficiency, or a deficiency of certain vitamins such as vitamins B12 and D. In addition, certain patients can also have serious problems absorbing proteins, even if they take their supplements, and must be treated with forced feeding or have an additional operation to reduce malabsorption. Laparoscopic surgery. All of these procedures are performed by laparoscopic surgery under general anesthesia, which allows surgeons to operate on internal organs without opening the abdomen. This technique involves 5 to 8 small incisions, or cuts, of 1 to 2 centimeters in length. These incisions enable the insertion of an instrument equipped with a lens and strong light, as well as other instruments required for the operation, into the abdomen. This instrument is connected to a television camera that allows surgeons to see the inside of the abdomen on a screen. The abdomen is inflated using carbon dioxide to help the surgeon see and work better. Preparing for surgery. Several consultations will be required prior to your surgery, the number depending on your health condition. You will meet with an internist, a gastroenterologist, and an anesthesiologist. You may also need to meet with other specialists. Your appointments will be scheduled by the preparation clinic nurses or the surgeon. You will also need to have several tests and blood work so the surgeon and other physicians consulted can properly evaluate your condition prior to your operation.
Hi, my name is Dr. Mesia.
My name is Dr. Como. We are both surgeons at the obesity clinic.
Which procedure is best?
Every procedure can produce excellent results for some patients and less positive ones for others. It's important to choose the best one for your specific situation. We know that certain interventions are more successful for some patients. You can evaluate which procedure is best suited to your condition by discussing it with your surgeon.
Can this type of surgery cause me to lose too much weight?
Excessive weight loss is usually only seen in cases of mental illness, such as anorexia. When patients eat properly, weight loss naturally slows down 1 year after surgery. It's more common to see patients who don't lose all their excess weight or who gain weight following the surgery.
Why do some patients gain weight after their surgery?
Two key elements play a role in maintaining weight loss following bariatric surgery: healthy eating habits, and regular physical activity. Patients who gain weight are usually those that don't maintain these lifestyle changes. Surgery is not magic. While it results in weight loss, it alone cannot maintain that weight loss.
Why will I have to take vitamins for the rest of my life?
Procedure that leads to poor absorption can cause deficit in certain vitamins and minerals. Taking a multivitamin that includes iron is required to prevent anemia. Vitamin B12, calcium, and vitamin D supplements are also required. This involves taking 5 pills per day. Obviously, it requires monitoring for life through annual blood tests.
How long before my operation?
If you're eligible for the optimal course, you'll be monitored by our team of nutritionists and kinesiologists for a period of 6 months. We'll then evaluate whether you're ready for a preoperative evaluation. If so, the surgery normally takes place 6 months later, unless a contraindication has been discovered. In short, if everything goes well, you'll have your operation within 1 year. During that year, you'll adopt lifestyle changes critical to your surgery's success.
What do I do with the excess skin as a result of the post-surgery weight loss?
The physical changes are significant during the first year following your surgery and may require several changes on your part. A significant loss of weight can result in loose skin that you may wish to have removed. Each person experiences these changes in a different way. Various surgeries to correct or remove excess skin on the stomach, back, thighs, arm, and breast tissues can be carried out by a plastic surgeon. These surgical procedures are not normally covered by the Quebec Health Insurance Plan or the Employment Insurance Plan. The plastic surgeon will advise you during the consultation.
Can I get pregnant following this type of surgery?
While pregnancy is completely safe following this type of procedure, it is absolutely necessary to avoid getting pregnant during the first 6 months after surgery. Because the mother is undergoing rapid weight loss, she may not be able to adequately provide nutritional elements to her baby. If you wish to bear children following this procedure, it's important to discuss this with your surgeon to determine the best time.
Don't hesitate to call us to discuss your concerns.
We're here to help you and answer your questions.